By way of disclosures, now, when I was tasked with this talk, I did what any respectable college student would do. I put it into ChatGPT, and within 30 seconds I got a wonderful outline that you can see here. So the hype. Sorry. If you don't recognize this woman, it's Elizabeth Holmes. She's the CEO of Theranos, and she's currently incarcerated for raising over $1 billion on false claims. And this is just a reaction. We have an innate desire to believe. If it's too good to be true, be careful. So the hype. One day in the future, it's hoped that AI will be able to identify patients, identify the lesion, and treat them. But, as Nelson said, that hype needs to be tempered. The data is key, because with poor databases, bias can be introduced, etc. Now, Nelson addressed these definitions, so I'm not going to belabor the point, except to stress that machine learning is a computational technique which learns from example, as opposed to operating from predefined rules. Now, AI's history really dates back to our ability to store data. And on the left-hand side, we see the Turing machine, which is the original decoder from the 30s. Fast forward to the 50s, we have the RAMAC computer with a storage of 5 to 10 megabytes, a weight of 20,000, and a cost of $31,000 a month to run. Now, Moore's law suggests that the computing power is doubled every 2 years. So fast forward to 1985, we have Garry Kasparov, a Russian chess champion, who was beat by the Cray supercomputer, which had a whopping 32 gigabytes of storage, 5,500 pounds, and $30 million. Now, Ken Jennings, the Jeopardy superstar, was defeated by the IBM Watson computer. And on the right here, we see now we can have storage upwards of 1 terabyte in less than half a pound for less than $1,000. So, how do I use AI today? I've written grant proposals, patient education materials, operative notes, as well as an apology letter to my wife for being late in the operating room. And it does a remarkably good job. Now, AI is currently being used in drug discovery, and in this Nature paper from a couple months ago, describes a whole new class of antibiotics which were discovered through AI. And these are all active against MRSA, VRE, etc. So, a huge step forward. Another way that AI is being used, the company I'm working with, Limi, has software which optimizes patient flow. So which patient seen by what provider, in what room, for how long. All of this to optimize clinical operations. And it can also be used to facilitate discovery. They've used this for a breast cancer test, which is fairly advanced now. The steps involved are they clean the data, develop the model, deploy the model, and this is the most important step. This is the machine learning right here. They monitor the prediction and they constantly evaluate for better performance. Now, this is one of my favorite uses of ChatGPT. This is using the Bing browser with a Copilot. So this is Jerry's paper, the PLCO, and Dave Crawford, I failed to mention. So I can just type in, write a summary of the paper that's seen here. And you can see a summary is generated. I could have typed in, find the strengths and weaknesses of the paper, a whole bunch of different things. So the promise of AI in healthcare. Nelson alluded to it before, but education is a huge opportunity, but as well, helping us make real-time decisions and facilitating diagnosis, and also acting as a scribe. Now, Epic is partnered with Microsoft. Microsoft owns Nuance and OpenAI, so they have unique opportunity to leverage expertise. I don't know if any of you have used Slicer Dicer, but it's a way of creating mini databases of patients from Epic. They can automate patient responses. So those Epic messages from patients, which are the bane of our existence, can now become automated. Acting as a scribe, Indy Gill at USC has done a fair bit of work on this and is coming up with a product which should be able to act as a scribe for us. So, in conclusion, AI has already had a substantial impact on healthcare and is poised to make an even greater difference. And I guarantee you at this meeting, next year we're going to be seeing a ton more. Although exciting, the hype of AI needs to be tempered by an appreciation of the potential bias of the AI models. And as John mentioned, we need to review responses carefully for errors in interpretation. Thank you.